Good afternoon. We are speaking on Treaty 6 territory, and I acknowledge the Métis people who share a deep connection to this land. I'm Janis Irwin, and I'm proud to be joined by many of my caucus colleagues and by our leader, Rachel Notley. We are all incredibly disturbed to see the news coming out of the United States last night, that their Supreme Court is poised to overturn Roe v. Wade and remove the legal right for a woman to seek an abortion. Embolden those who seek to roll back our rights in Canada. Women's autonomy over our own bodies is being threatened. I know many people in Alberta may have taken for granted that abortion services are a regular part of the public healthcare system. And that is exactly as it should be. Under an Alberta NDP government, women's reproductive services will always be publicly insured healthcare. While access to abortion is currently decriminalized in Canada, there are still barriers to services and supports. There is currently a bill before the House allowing bereavement leave for pregnancy loss, but this bill only provides leave when a woman has a miscarriage or stillbirth. It discriminates in terms of the kinds of pregnancy loss a woman experiences. This bill must define pregnancy loss to include abortion and termination for medical reasons. We will be putting forth amendments in the House to make these changes to the bill, and we will see how the UCP votes. As understanding and support for the importance of reproductive rights grows, decisions like those being made in the US would be a massive step back for women's rights and undermine decades of progress. We stand with all of those before us who have fought for reproductive rights and those who continue to fight for reproductive rights. And we must all stand with women around the world and continue to fight for reproductive freedom and defend abortion rights. To talk more about this, I'll pass things over to Rachel.
Thank you so much, Janis, and thank you to all my colleagues for being here. I know that this is a dark, dark day for so many who fought so hard for reproductive rights, for women's health care, for women's equality. I know that many Albertans are concerned over this news and what it will mean for us here in our province. I am one of them, as are my colleagues, all of them. The landmark decision that legalized abortion in the US in 1973 was a victory for all women. But we know that those who seek to roll back women's right, those who seek to reinstate discrimination against women, have never rested. This recent news is yet more evidence that the fight for equality may truly never be over. It's a stark reminder that elections have consequences and that our most basic right to control our own bodies is still under threat. So we cannot be complacent. We cannot take these rights for granted. Reproductive freedom and gender equality should be principles we all share. Now, as Premier, I was proud to introduce legislation to better prevent the harassment of women seeking an abortion. We created a safer environment for both staff and for patients. And 4 years ago to the day, while the NDP stood up to protect women to establish bubble zones around abortion clinics here in Alberta, UCP MLAs all walked out of the chamber. Today's news is also a reminder that although abortion is currently decriminalized in Canada, there are significant problems with access to abortion. Abortion is a medically necessary service, yet people who live outside of urban centres face barriers in accessing services. Access is still largely restricted to just Edmonton and Calgary, and we do not have a complete picture of resources and other barriers at play. This is why our government provided public coverage of Mifagamiso, the abortion pill, for Alberta women when we were in government. Any women seeking reproductive health services should be able to do so in a safe and timely manner close to home. Full stop. As reproductive freedoms are being eroded in the United States, Canadian politicians at all levels of government must declare their unwavering support for a woman's right to choose. I give Albertans my categorical guarantee that an NDP government will do everything we can to protect reproductive rights here in Alberta and frankly across this country. We will be seeking the same commitment from the UCP government in the House today. I'm calling on Premier Jason Kenney to reaffirm Alberta's commitment to a woman's fundamental right to choose, guarantee he will do nothing to further restrict access to reproductive health services, and join me in condemning this attack on reproductive rights and through that, women's equality in North America. I look forward to a fulsome conversation in the House this afternoon, and I hope that the UCP can commit to Albertans that they share our unshakable commitment to women's rights. Thank you, and we're happy to take your questions. Well, today our ask is more general than that. We are asking them to join with us in condemning this move in the United States, and to further commit that there will be no rollback of any type under a UCP government here in Alberta. In terms of increasing access, we know that what we have to do is properly fund our public health care system, because it is within our public health care system that women exercise their right to choose. And that's the best way for it to happen. We know that not every woman in every community can access certain forms of abortion services. And as I say, that's why we decided to fund Mifika-Miso. But there is more that we can do, and we would like to see the UCP government do that. And of course, as Janis mentioned, there is a bill in front of this House right now that would give leave to women who suffer miscarriage or stillbirth, but is silent on whether they would get leave for pregnancy termination for other reasons. And so they need to start by fixing that.
Outside of Calgary and Edmonton, as you just mentioned, is quite restricted to those two cities. So the north and the south and the center zone, what are your plans for this?
Well, what we would do, of course, is engage in an analysis with Alberta Health Services through Alberta Health to look at what the barriers are and what the ability is to provide those services. It often depends on having the healthcare professionals there who are prepared to provide that service. And so so we would look at that, and then we would take whatever steps we think we could to expand access to it. And as I said before, that's why Mifika-Miso was one of our critical things, because that, of course, helped expand it considerably.
Janis, you spoke about a potential ripple effect from this decision. I'm wondering what you're seeing in Alberta right now. I mean, we saw the latest fundraising numbers. Had the Pro-Life Association right behind well, not right behind, actually, far behind, but raising a substantial amount of money last year, $338,000. What do you make of that?
Yeah, and I think the piece around the ripple effect is an important one. You know, we've seen from this premier someone who said that he and his government are not going to legislate on divisive social issues, and that his views have evolved. But that's this is the same government that shortly after that introduced Bill 8, which made the UCP government the first provincial government across Canada to effectively roll back LGBTQ2S+ rights. We saw that not long after. We saw Bill 207, which was conscience rights legislation, which presented a huge threat to queer and trans folks accessing health care, and of course women's access to health care, including abortion services. So we absolutely have reason to not trust this government when it comes to protecting women's rights and queer and trans health care.
Rachel spoke about possibly getting AHS to do an analysis of access in the province. What kind of investment would you like to see in expanding access? What do you think would be appropriate, and how many more facilities do we need in the province?
Yeah, I mean, I think we'd obviously need to do the analysis and do the review. But I can point to, it was just in 2019 when the Bill 207 debate came up, we heard literally, my colleagues and I, from thousands of Albertans, the heartbreaking stories of women being denied birth control at that time in 2019, and it's still happening today. And that's just birth control, being denied care from their physicians, and not just in rural parts of the province, although I heard a lot of those stories, but from urban areas as well. So as Rachel said, I mean, we need to do a comprehensive review, and we need to listen, and we need to start supporting healthcare, not just in rural areas, but across this province, and protect healthcare workers as well, who we know have experienced so much.
How would you compare Alberta to other provinces? I mean, it seems like we lag in terms of the ratio of facilities that are available behind other provinces.
Yeah, I mean, I can't speak to specifics, but I think there's around 5 right now clinics that provide abortion services here in Alberta, which we know is insufficient. And so I think, obviously that would be a big first step. And as Rachel outlined, I mean, I was proud of our government and the steps that they took, including bubble zone legislation, as well as investing and funding in Mifagamiso. So those are 2 big steps forward, but we'll do more. And that's our commitment when we form government, that we will absolutely prioritize women's access to healthcare.
Calgary, there's Women's Health here, and then there's Peter Law.
Do you know?
Yeah.
I believe it's 5. Yep.
Yeah, the Lougheed was the 3rd one that you were mentioning, and those are the ones that make overt that they can get services there. But because of the chilling effect that we've seen in so many parts of this province against healthcare providers, the harassment and the intimidation that they're facing, there are some other physicians who provide more services, but you have to be part of the women's network that talk to one another to find out where you can go to get them, because they're afraid of harassment and intimidation. That's why we brought forward the bubble bill legislation that Jason Kenney and the UCP ran out of the House on. That's why we're standing here today to say, under a Rachel Notley government with the NDP, women across this province, we're going to have their backs. And that healthcare providers in other parts of the province won't have to be afraid to talk about the kind of services that they are willing to provide to healthcare patients. Out of respect for them, I think I'll direct the question to AHS, but there are some physicians who are providing additional services that aren't comfortable talking about it, even though it's completely illegal, even though it's a basic healthcare right. They're part of the Whisper network, so there is a significant intimidation, and we're here to stand up against that. Do you want this, Rachel? Yeah.
Well, I think that underlines the original point that brings us here today, is that you can never take these fundamental human rights for granted, that you must always fight to protect equality. Banning abortions is a form of discrimination against women and their right to choose what happens to their bodies. And the fact that even before we heard about the Supreme Court or the U.S. Supreme Court draft decision, that we in Alberta were still and are still dealing with the kind of intimidation that can be brought to bear upon healthcare providers who seek only to provide to women the healthcare that they have a right to. So it is not a job that is done. And that's why we are so concerned about this draft decision being released. And that's why we believe it is so important for all members of government to stand up and declare their support for a woman's right to choose and for reproductive health, because the fight is not over. The situation that Sarah describes gives evidence to the fact that the fight is ongoing. And so now is the time for leaders to stand up and stand for equality.
From the United States come and seek abortions here in Canada, including in Alberta? Would that be possible?
I think it's certainly possible that we'll see that. I think we will also see a lot of fatalities. I think we will see women seeking those reproductive health services in unsafe situations. And I think that we will also see a growth in poverty and a further depreciation in the rights of women on multiple fronts throughout the U.S. And so it's concerning. I also believe, as we have seen in so many other levels, when extreme right-wing conservative views in the U.S. pop up, and we all say, oh, gee, isn't that horrible that's happening down there? Suddenly we see it leaking up to Canada a few years later. And so I think that what you will see is a redoubling of efforts to protect the rights of women in this country.
What's your message to men? I see you're all women today. Obviously, you're presenting a united front, which I understand, but
Well, that is a very good question. And let me say that I know that we enjoy the support of every male member of our caucus. We deeply appreciate that. And I think that all Albertans, male, female, trans, need to come together to stand up for fundamental human rights, for freedom from discrimination, whether it be on the basis of gender, sexual orientation, race, religion. We cannot accept fundamental state-authorized discrimination. That's what this represents, and we must all come together to protect all of our rights and each other's rights.
Bill 17, you mentioned that abortion is not explicitly spelled out. The government has said, well, the employers aren't allowed to ask that. So can you explain a bit more about why you feel abortion needs to be specifically spelled out?
Because it is not clear in the legislation. The legislation refers to miscarriage, it refers to stillbirth. The debate in the House, we asked, does it include termination for medical reasons? Does it include abortion? And the minister specifically refused to give us an answer. And so when that matter becomes the subject of litigation, people will look to the debate in the House and see unclear language and then the refusal of the Justice Minister to answer the question. So that is why we now have to seek an amendment to provide clarity. The last thing you want is for women to have to litigate the meaning of legislation when they're asking their employer for bereavement leave. And so it's incumbent upon the government to make this benefit and who is entitled to it crystal clear.
Somebody CHQR. My question is for anyone can answer this question, and I'm sorry if this was asked before, but you know, this issue isn't just an issue that affects women, it affects trans and non-binary people. So how will you make sure that trans and non-binary folks are also able to access safe abortions and bereavement leave?
Well, that matter is being debated through Bill 17. I know Janis has been leading that, so I'm gonna, I know, and I think there's been discussion already, and I'll let her speak to it.
No, and I really appreciate you raising that question, because I think we're all still learning in our language too. Admittedly, you know, we've said women's health a lot today, and we need to be inclusive, and so absolutely that's our commitment to speak more broadly about reproductive rights. You know, I mentioned a little bit earlier some of the concerns we heard when Bill 207 was in the news, the conscience rights legislation, and you know, the stories I heard from trans folks in particular, the barriers that they face in accessing healthcare, they're huge. You know, when a trans person faces delayed healthcare, that often means deadly healthcare for them. And you know, I've asked the health minister in budget estimates as well as in the House about how they will commit to increasing support for trans healthcare, and unfortunately we've not had a lot of action on that front. So we're going to continue to call on this government to do better, and of course, you know, when we have the opportunity to form government, queer and trans healthcare will certainly be further uplifted. So absolutely, it's on our radar, and I appreciate you asking the question around inclusivity. And in Bill 17 as well, you know, we've connected with a few stakeholders who work in the area of pregnancy loss, and they've been really clear too that let's use inclusive language. Let's not just talk about women experiencing pregnancy loss. Let's talk about trans and non-binary folks, and also the impact on the spouse, whether that spouse, whatever gender the spouse is, too. So I appreciate that.
Any follow-up?
Yes, I do. I'm also wondering how you will address abortion access issues faced by Black, Indigenous, and other people of color, such as racism experienced in the medical field and lack of culturally inclusive resources.
Oh, sure. I'll have Raki answer. Just say your name.
Hi, thanks very much. It's Raki Pancholi, MLA for Edmonton Whitemed and official opposition critic for Children's Services. You know, that very question is work that we have been doing as a caucus for some time now. We actually spent a number of months consulting with Albertans on this issue of anti-racism work, and specifically looking at how racism can be part of all systems of government and programs. So that includes healthcare and education and the criminal justice system. And a lot of the work that we did on the access to healthcare, we talked about the importance of having race-based data, and our colleague, the member from Edmonton City Centre, David Shepherd, recently brought forward a private member's bill that would require government to collect race-based data in all of the programs and services that it delivers, for this very reason, to be able to identify and address systemic racism. Unfortunately, the UCP would not even allow that private member's bill to come to the floor of the legislature for debate, and it was quite shocking because this was work that was developed in consultation with Albertans and stakeholders who spoke to the importance of race-based data. So when we're talking about access for Black women and racialized women to have access to healthcare, the data is key to that. We've talked about the need to do that, you know, analysis of where the barriers are. We also need to do that analysis not just on physical barriers, but also on racialized barriers. And so collecting the data is absolutely critical to that. We continue to maintain that that's an important part of making sure that all women and gender diverse folk have access to appropriate healthcare, including reproductive services. We need to have that data so we know that we can develop systems that support them.
Do one more pass for questions. Star 9 if you're on the phone. Raise hand if you're joining us via Zoom. Seeing none, that's all for today. Thank you.
Thank you.
Thank you.
Thanks, guys.
So much for watching, and to learn more, check out albertasfuture.ca.